Once again, welcome to our Multicultural Conversation webinar series. Today's topic of the conversation is mental health, and I'm the host. I'm Hillary. I'm the NAMI New Jersey Camp Hub Statewide Program Coordinator. And we're happy to have our EGNOW Program Coordinator, Melanie, and our guest speaker, Derek, a third-year medical student, with us tonight. Thank you, Melanie and Derek. I would like to briefly introduce NAMI New Jersey's mission. We are a statewide nonprofit organization. We're dedicated to improving the lives of individuals and families affected by mental health illness. We do it through education, support, advocacy, and public awareness programs. NAMI New Jersey fosters understanding about mental illness, confronts stigma often associated with mental disorders, advocates for public policies that benefit those affected by mental illness, and promote research into the causes, treatment, and recovery of mental health disorders. I would like to introduce you our outreach services. The first one is In Our Own Voice, which is a powerful presentation that aims to change attitudes, assumptions, and stereotypes about people living with mental health conditions. To train the presenters with lived experience of a mental health conditions talk openly about their experiences and how they have found pathways to hope and healing. The second one is NAMI School Education Program. The program's goals are to educate youth, school staff, and adults about mental health and mental illness. The third one is Ending the Silence, which is a free, evidence-based 15 minutes in-person presentation designed for middle and high school students. After all, I would be happy to introduce you our multicultural outreach program. And the first one will be EGNOW. I would like to pass the time to EGNOW Coordinator Melanie to briefly introduce her program. Thank you, Melanie.
Hello, thank you. EGNOW is one of our 4 multicultural groups of NAMI New Jersey. EGNOW was created to increase awareness in the African American community about mental illness and health and how it affects the community. Our aim is to connect with New Jersey African American families, the faith community, and mental health professionals to provide mental health education, support, advocacy, and culturally competent programs. We currently serve the community by having monthly support groups. We table outreaches. We have community conversations and solutions that would be through our Sharing Hope program. We educate the community through family to family and other outreaches, and we spread the word about our programs. Thank you.
Thank you so much, Melanie. And I will introduce my program, the Camp Hub program. Camp Hub is a NAMI New Jersey initiative to serve individuals with lived experience of mental health conditions and their family members from the Chinese community in New Jersey and beyond. We do it through support, education, and advocacy. We provide free services, include NAMI signature peer-led program support groups, and education programs. We also provide information and referral services and educational materials in Chinese language. The third one will be NAMI Expanio. NAMI Expanio is an awareness and education program developed by NAMI New Jersey to serve the Hispanic and Latino community in New Jersey. The program coordinator of NAMI New Jersey Expanio is Ms. Len Nelly. Our last multicultural program is SAMHASH. SAMHASH provides education, support, and advocacy for South Asians affected by serious mental illness. South Asians of Asian Indian and Pakistani origin, as well as those from Bangladesh, Sri Lanka, Bhutan, and then Maldives are also welcome to seek support and information from Sam Hash. So today our topic is men's mental health. Why we picked this topic in tonight's conversation, because men's mental health issues are always being overlooked or ignored by society, as we all know. The pressure on men to succeed in the eyes of society, different lifestyle, social norms, and unrealistic expectations prevent them to seek help. According to Mental Health America, 6 million males are affected by depression each year. However, men are less likely than women to seek help for depression, substance abuse, and receive less counseling and therapy services. Tonight, let's end the toxic masculinity which discourage men from getting mental health treatment, and let's discuss how to encourage the men in your life to take care of themselves. Now, I will pass the time to our guest speaker, Derek. He is a third-year medical student at Rutgers Robert Wood Johnson Medical School. Derek, thank you.
Thank you. I'm just gonna share my screen. So I think only one person can do it at a time. Okay, perfect. Oh no, there we go. Oops. Hi, everyone. My name is Derek. I'm a third-year medical student at Rutgers Robert Wood Johnson Medical School, and it's a big honor to be able to talk to everyone today about this topic of mine, which is really important to me: mental health in the Asian American and Pacific Islander community, specifically in AAPI men. So due to the time constraints, this is just going to be a brief presentation. So if you have any questions, feel free to email me afterwards. So this is just one of the few rhetorical questions I'm going to ask throughout the presentation. In this case, I would just like to ask you to reflect: what does mental health mean to you? Specifically, what does it mean to you to be in good mental health? So the World Health Organization has a twofold definition in terms of what mental health is. The first part of the definition refers to the absence of disease or infirmity. Essentially, it says having good mental health means, one, you do not have a mental illness. There's also a second part: the ability of an individual to thrive. In this case, realize their abilities, cope with normal stresses of life, work productively, and give back to the community. This part focuses more on the psychosocial conditions that one is raised in. So for me as a student, being in good mental health would mean, one, being not disabled by mental illness, and two, being given the resources by my community and my school to reach my academic goals and to thrive. A good mental health can take a unique definition for everyone. Everyone has different goals in life, and it looks different for everyone. But today, I will focus more on the first part of this definition: mental illness. I think it's very important to talk about good mental health, because the inverse, bad mental health, whether from untreated mental illness or poor psychosocial conditions, can lead to poor quality of life or even suicide. Mental illness and its consequences can affect those of us and those close to home, including our peers, friends, and our family. I receive emails, every few months of a student unfortunately taking their life at the university that I attend. So in 2014, a group in the University of Hawaii did a secondary analysis on the first national survey on Asian Americans. They found that nearly 18% of AAPI men experience a mental illness during their lifetime. The most common conditions were anxiety disorders, such as a generalized anxiety disorder, followed by mood disorders like depression or bipolar disease, followed by substance abuse. What's interesting is that compared to AAPI women, AAPI men have more than 3 times the rate of substance use disorders. So to reiterate, if you round up slightly, 1 in 5 AAPI men experience mental illness in their lifetime. So if you're in a peer of 5 people, that is 1 of them. And literature points to many risk factors that can moderate this, meaning that risk of 1 in 5 could be even greater. Because of the length of this presentation, I'm not going to touch upon everything, but I want to touch upon a few points that I think are very important. First is gender and sexuality. So the topic of this overall presentation includes toxic masculinity, and I think that's very much true for Asian culture. AAPI men are unfortunately expected to perpetuate this patriarchal standard of being this stoic, strong breadwinner of their family, fulfilling a traditional expectation, but this also encourages suppression of their own emotions. Additionally, LGBTQ individuals who have to navigate the intersection of their Asian and LGBTQ identities may experience further complex issues relating to self-acceptance, cultural expectations, and social support, leading to increased vulnerability to mental health issues. The next is trauma. So in some cases, Asian immigrants may have fled from war-torn countries, experiencing significant trauma before arriving in the United States. It's also true that within families, trauma and domestic violence could be an issue. And the victims of this abuse can suffer from long-term consequences such as anxiety, depression, and post-traumatic stress disorder. The next topic refers to societal expectations, specifically the model minority myth. Many of you are aware of this model minority myth. So it arose in the United States in the 1960s due to various legislative policies and cultural movements. Essentially, it suggested that the AAPI community was exceptional in their education and their careers and other aspects of their life. However, this myth is an overt oversimplification that ignores the diversity within the Asian American community, including ethnic and social demographic diversity. It ignores historical struggles in Asian history, and it can be harmful to mental health by putting undue pressure on individuals to meet unrealistic expectations. So if you fail and if you don't succeed with the model minority myth, that may be seen as a lack of work ethic, being lazy, or a sign of failure. And then finally, immigration status and nativity. So I myself am a child of Chinese immigrants, and growing up in America, you're exposed to a different set of stressors than coming into America. Both processes are stressful in their own way. But it turns out that compared to immigrant AAPI men born and raised in the US experience higher rates of mental illness. This could be due to various reasons, including discrimination and identity conflicts, which can contribute to feelings of isolation, alienation, and a diminished sense of belonging, which are risk factors of mental health challenges. Meanwhile, immigrant counterparts, while not always, I always discourage generalization, may have more protective cultural factors and established support systems from their families and their communities. So I do want to ask this leading question: do AAPI men with mental illness have higher, similar, or lower rates of utilization of mental health services? Well, as you can expect, the answer is AAPI men have the lowest rate of mental health care services among those with mental health illness. So just to walk you through this graph, if you look here, these blue bars represent men, and they're men with mental illness, and the percent that uses mental health services. The bars in red represent females with mental health illness, and the percent reflects that which use mental health resources. And this is split by ethnicity. As you can see, there is a trend of men in each ethnicity using less resources than their female counterparts. But across every group, across all ethnicities and genders, Asian American men use the lowest, Asian American men with mental illness seek out mental health services the least. And if anything, this is underestimation. Problematically, the census has only recently included different groups, different ethnicities that weren't previously included in the AAPI banner. In large studies and large surveys, all of the AAPI communities that come across different parts of the world and have different stories are often thrown on the same banner of Asian. This is obviously a gross simplification. A Chinese immigrant will have a completely different experience from a non-Chinese AAPI immigrant. So unfortunately, we still lack the granularity to make conclusive statements about what specific AAPI ethnicities have the worst mental health services utilization. So here's also another very important question. Why do AAPI men decide not to use mental health services? I think the easiest way to understand this is breaking down the decision to use mental health services into three main steps. And across each step, there are barriers. And I just want to make sure that we understand that this is not exclusive just to AAPI men. These barriers apply to other groups, other ethnicities. But this presentation is focused on AAPI men. So the first step is recognizing you have a problem, in this case, a mental illness. So in America and across the world, mental illness is considered a very personal and sensitive subject, which I am not denying that it is. However, it should never be considered a taboo subject. Unfortunately, cultural stigma in AAPI communities may discourage discussing mental health and mental illness, which means that when you have symptoms like depression, recognizing those symptoms as a treatable disease is more difficult. Additionally, due to the idea of toxic masculinity, some may have issues like anxiety or depression, but try to minimize these struggles, dismissing it as nothing to worry about and never seeking care, but rather internalizing these problems. The second step is deciding to seek help when you believe that you have and are suffering from a mental illness. So coping strategies, including very bad ones like drinking, may temporarily delay the need for treatment for mental illness, but it only keeps it away until it gets too bad, until it becomes so severe that you cannot continue to ignore it. Additionally, sometimes one may not know the options available. The lack of representation in culturally relevant mental health stories for AAPI men continues to perpetuate this problem of not communicating what options are available for members of this community. Finally, there are barriers to finding and choosing a service for mental health care. And this is especially difficult when you want to find someone who understands the AAPI experience, who speaks the language you are most comfortable in speaking, and of course, falls within your budget. Therapy and treatment can be extremely expensive. This is one of my favorite movies, and I just cannot highlight how important representation matters. Um, I think telling the stories, the diverse stories of the AAPI diaspora is an important step to gradually reduce the cultural stigma that leads to the difference between good and bad mental health. AAPI individuals should feel more comfortable with recognizing and seeking help for mental illness, but they often don't because society only often sees that model minority, and thus they believe that they should behave like a model minority and not seek treatment. So I would just like to share my story. So I grew up with excessive anxiety as a kid. So I would have trouble sleeping at night because I was worried. And this sounds funny, but this is true, that a meteorite would drop from the sky and destroy my house. You know, growing up, before I slept, I would sneak downstairs and I would make sure that all the stovetops were turned off so that the house wouldn't burn down, and that the doors and the garage doors were all locked so that no one would break into my house and decide to rob me. In college, the smallest conversation would lead to me overthinking the minutia of what they said, the gestures that they made, and whether some mistake of my part could lead to disastrous outcomes. Failing a test not only meant that I would score poorly in that class, but my GPA would be bad, and then I wouldn't be able to get into a good career path, and then my entire life was ruined. I kept on having these anxious thoughts, and they consumed my daily life to the point where I often isolated myself. In college, when it's a time to go out and have fun, I often isolated myself so I wouldn't have to deal with these thoughts. Obviously, this is not a healthy lifestyle. And thankfully, I recognized this after struggling in college for a bit. And so I reached out to find a therapist within my school. So I went to the University of Michigan, and there's this service called CAPS. And I found an AAPI therapist through CAPS. So I had therapists before, but never an AAPI one. And I felt like she validated my struggles in a way that the others didn't. For one, she said that I potentially had an undiagnosed anxiety disorder. Now, I thought the problems that I had before was either problems that everyone suffered from or just something wrong with me. I never knew it was actually a disease, something that is completely normal and could happen to anyone. Two, she also said that part of my stress was because I internalized pressure to succeed placed by my parents, myself, and those around me, setting the bar so high to thrive so high that nothing I could do was enough. And I think many people in the AAPI community can relate to this feeling. And mind you, I was a good student. I had a good GPA, not to brag or anything. Not that it matters too. In 2021, before I started medical school, I knew that I couldn't continue with my anxiety. So I decided to continue seeing a therapist and a psychiatrist, and started seeing a psychiatrist, the latter who diagnosed me with obsessive compulsive disorder, a disease where people suffer from mental obsessions and have to act out with compulsions. For example, you have thoughts that you can't stop, so you count 5, 4, 3, 2, 1, 5, 4, 3, 2, 1, so they go away. And they prescribed me with a drug called an SSRI, or selective serotonin reuptake inhibitor, which I continue to take today. So I'm on my psych unit right now in medical school, and I meet a plethora of patients who have it a lot worse than I do. I think I have a very cut and dry mental health journey, but still, despite me having such a simple case, there were so many different confusing points, especially as someone who didn't want to tell my parents that I was suffering from these issues, that I had difficulty navigating myself. For example, I had no idea what the difference was between a psychologist, a therapist, and a psychiatrist. Even now, the differences in the therapies that they provide, I still do not completely understand. I think what's important is that they all play a key role in delivering mental health services to patients. However, psychiatrists are doctors who are able to provide a formal diagnosis and to, most importantly, recommend medication. However, especially social workers who are licensed to give therapy are uniquely positioned to address social determinants of health or the psychosocial conditions that contribute to bad mental health. Therapy. Finding therapy can be extremely tough, and finding the right person is even more difficult. I was extremely lucky to find the right person for me in college. And I actually stopped going to therapy because I never found someone who was as good as her. And since I graduated, I wasn't able to use her services anymore. However, I don't want that to be discouraging. I want you to recommend yourself or your peers to look in your school, in your workplace, in your community, or even online for a therapist right for you, because I think therapy is so important. And without therapy, I wouldn't even decide to consider a psychiatrist. The third point, and the most important, sadly, is medication. There's a lot of stigma surrounding medication for mental health, and that can be a significant barrier for many individuals and families of those individuals. And this arises from misunderstandings and negative stereotypes. I see this all the time. And some of the common concerns contributing to this stigma is the fear of dependency, that taking drugs makes you weak or crazy, or that these drugs give you unwanted side effects. The way it was explained to me is that few people view heart medication as an addictive drug. But psychotropic drugs are the same. They're meant to manage a chronic illness. Just like heart medications keep hypertensive emergencies away, psychotropic drugs keep mental health crises away. They're chronic drugs, and just because you use them every day doesn't necessarily mean you're addicted or you're dependent. The fourth point is alternative medicine practices, like meditation, yoga, acupuncture, and mindfulness, all of which I tried in the past. They are used as complementary approaches, but they have a certain limit in what they can achieve. I used meditation apps throughout college before I formally tried therapy. And in therapy, I heard it described as this. These alternative medicine sources like meditation, yoga, acupuncture, and mindfulness can help your ability to control things like anxiety. But in some mental illness, the amount of anxiety you have is uncontrollable by any means. What medication does is it reduces that amount of anxiety to a point where it's like a normal person. Actually, normal is not the correct term, but forgive me. Where it's a controllable amount so that these techniques can actually help and become effective. Lastly, healthcare navigation. So I decided to pursue this journey and find resources for myself alone by navigating online. However, it was definitely not the most effective way to do so. A healthcare navigator, like a social worker or an advocate like CamHop, can help people find their way through the complex mental health system, ensuring that they receive appropriate care and access to resources, such as insurance, which can help you afford mental health services in the first place. In summary, there are a few key takeaways that I would like you to leave today understanding. First is 1 in 5 API men experience mental illness in their lifetime, but the risk is higher in certain groups. Think, a refugee who experienced trauma. Obviously, the risk for mental illness is higher. AAPI men have the lowest rate of mental health service utilization across all ethnicities and all genders. What I'm saying is that healthcare messaging should not be detracted from other groups, but rather there should be improved representation and education for AAPI men and within the general AAPI community that can help reduce stigma and encourage people to seek care for mental illness. Thank you for listening to me ramble. If you have any other questions, please reach out to me at this email, dg777 at yada, yada, yada. Thank you so much. Appreciate it.
Thank you, Derek, for giving us such a meaningful and informational presentation. And then thanks for sharing your own experience as well. We do have 2 questions for Derek here. Okay, let me read it out for you, Derek. Okay, this participant would like to say most of males do not equally share the responsibilities for parents. Therefore, boy may lack of role modeling from his father in early childhood. Do you agree this may affect men's mental health in their future life?
So I think there's a certain point that you may be getting across, which is what we generally consider something called adverse childhood experiences. So things like, domestic violence or even divorces can have long-term consequences on multiple domains of health, including things like your cardiovascular health and your risk of mortality, but also conditions like mental health. I admittedly am not entirely sure I'm addressing your question, so please feel free to clarify. But I agree that having a good role model is important, and not having good role model can have long-term consequences. However, the reason why I don't like showing the general statistics for the incidence of mental health across groups is no matter who you are, if you have a mental health problem, you should seek help. It doesn't matter how you come across it. It can come across in different ways. No matter what, you should seek help for it in some type of way.
Thank you, Derek. And the other question is from Baoju. It's only just saying she wants to speak to Derek. I'm not sure whether Baoju wants to read your own question by yourself. Let me try to unmute you. Just a second. Oh, Baoju is just off, maybe the connection issue. Okay, we'll wait for her to come back. And then I can see another question about in Somerset County area, where is a good place to look for psychiatrists? Psychiatric,
Yeah.
I think.
Yeah. So again, like a psychologist gives therapy while a psychiatrist is an MD that is able to give you a diagnosis and medication. So if you're in Somerset County, you can look at the major health systems in that area, perhaps Rutgers or Hackensack. You can also look for private practices, which may be slightly more expensive. For me, I decided to go through the route of private practices just because it'd be a bit awkward if my provider is also my boss on my rotations. But whatever, really, it's more of how your insurance covers it, and whether it's whether it's affordable. That was a huge problem for me. I mean, psychiatrists are very expensive, and also what your unique needs are. So, for example, if you have a more severe mental illness, you may need to be closer so you can go there more often, unless you would like to attend over Zoom, but some people don't really like that. However, I need to check up on my dosing every 3 months. So I actually just give a quick call while I'm walking from place to place, and then I ask for a refill there. So it really depends on your needs, but I really suggest looking up online psychiatrists in my area, seeing their profiles, their reviews, and choosing someone who you think has a good background and who has positive reviews and you think is nice. And if you don't like them, you're not in debt to them. You can just find someone else.
Thank you, Derek. Okay. For all the registrants and participants, if you're interested in finding psychologists or psychiatrists and you would like to get more information, you're welcome to visit our NAMI New Jersey webpage or email us. And also you can search online through the Psychology Today, which you can show more information like suitable for you in your area, living area, or which language you prefer to use as well. So, okay. Now I would like to move forward to the discussion part. The first thing I would like to discussion would be like, how do people interpret men's mental health in your culture? And I know that some of our panelists would also like to share. Let me go first, okay? In my culture, it's really hard for people, no matter for men or women, to talk about mental health conditions. We do believe that nothing would be too difficult, like for an adult. We can overcome all the difficulties. We believe that, which is not true. And we always need to be strong, rational, and have strong problem-solving skills. For men, especially, we assume men rather bleed and don't cry, which means men are supposed to be brave and strong. That means men don't show any weaknesses to others, especially emotional struggles. And in my culture, men also cannot be vulnerable. They should ignore or neglect their own feelings. And there's an also study found out that among white college students, Asian American men are viewed as less manly than white or Black American men. I do believe that it is because the body type of Asian people, but definitely we know that body shape does not affect one's manliness. So I feel no matter like you are a man or woman, sharing feelings and your needs do not equal to being weak, of course. And I know that our other program coordinator, Melanie, would also like to share how people in her culture see men's mental health.
Thank you. Yeah, I think with men in the African American community, it's a lot of pressure for the succeeding and a lot of pressure to be like the head of the household and a lot of pressure to not express, sometimes how much of a like weight that is on them. So a lot of times when they're out, working, 2 jobs, 3 jobs and working long hours on, one job, it, kind of compresses down to, well, that's what you're supposed to just do. Don't talk about it. Just keep going. Pull your self up by the bootstraps, basically. Like don't show any type of weakness because it's seen as, not something that men do. So that creates like almost like a culture of not being able to speak about things, even though you're going through things. And a lot of times we don't have the words to articulate what's going on with us. A lot of times we know that we're, depressed or something. We know that we're, might be anxious about something or have anxiety, but to be able to articulate them and put those in words, it's very difficult because we just want to keep going and keep doing everything day to day. So I think that's what happens a lot of time with the men in the African American community. It's just keep going, just, bury it down. Oh, it'll be okay. This is what you're supposed to do. So a lot of times that's what happens. And it's like, A lot of times when we want to actually go out and get the help, statistic wise, we're not very represented well as, we only have like 2% of psychiatrists that are African American and 4% of clinical social workers are African American. So we want to be able to go to someone that looks like us and that's culturally competent, because we don't want to go over and have like a barrier right then and there. Like, is somebody going to understand what I'm going through? So I think that's what happens a lot of times in our community. And that happens with the men mostly because they're as seen as the head household, the provider and stuff like that. And they're the gatekeepers of, the family. So a lot of times they don't have that outlet to be able to talk to somebody. So a lot of times, therapy is seen as, oh, that's something we don't want to talk about. That's something we don't want to do. So that's what happens a lot of time in our culture.
Thank you, Melanie. And one of our program coordinator from NAMI NJ Manual, Miss Nelly, she also have something to share with all of us. Let me share a video for all of you. Melanie and Derek, can you please let me know that if you can see the video right now?
Yep.
Thank you.
Thank you. In Hispanic culture, mental health in general is stigmatized. But when it comes to men's mental health, there is a tremendous amount of judgment clouding the topic. For example, if a man mentions that he goes to therapy or he is receiving help or any kind, they lose their influence as a man. Men in Hispanic culture have been groomed in a way to think that vulnerability is a weakness. And if they demonstrate this weakness, they lose their value as a man. However, in light of recent events, there has been an increase in the number of men who choose to attend or participate in our support groups. Oftentimes, men feel outnumbered by the number of women in a support group, which is why I think maybe it would be a great idea to host a support group solely for men. Thank you.
Thank you, Nelly, although she's not here with us tonight, but thanks for her sharing. All right. Actually, I have prepared some of the discussion topic for all of us tonight, but it's due to the time restriction. It seems that we don't have enough time to go through all the questions. But before we go to the resources section, I would like to share more about the toxic masculinity. Actually, what is that? Toxic masculinity refers to the notion that some people's idea of manliness, preceptions, domination, homophobia, and aggression. Toxic masculinity involves cultural pressures for men to behave in a certain way. And some researchers have come to agree that toxic masculinity has three core components. It includes the first one, toughness. This is the notion that men should be physically strong, emotionally strong, and behaviorally aggressive. So that's why sometimes people will rationalize men's aggression behavior. And then the second one, the second component will be anti-femininity. This involves the idea that men should reject anything that is considered to be feminine, such as crying, showing emotional, or accepting help from others. The third component is power. That is like what Melanie's mentioned before. This is the assumption that men must work toward obtaining power and status, whether in a social and financial perspective. And then just like what Derek said before, fathers always should be the breadwinner in the family. So we think that men should be the one who gain respect of others. So not to show the weaknesses. And I do hope that after tonight's conversation, we all help to end the toxic masculinity. And then I would like to show you a short video about this topic. Let me share the screen again. Right. All right. All right, here we go.
I don't mind.
All right.
Let's do it.
We as men are historically taught to provide, to protect, and to think that crying is weak.
That mentality took a toll on one man's mental health as he deals with the loss.
Yeah, his mind was in chains until a loved one helped him find the key to unlock true manhood. In a place where results are defined by consistency, Darius Mitchell trains his strongest muscle, his mind.
I'm lifting weights and tears are coming down my eyes. I never would have thought in a million years, it would have been him.
Mitchell is balancing the weight of losing his brother, Christopher Montgomery. He died by suicide 4 years ago.
He died from a broken heart.
The grief was overwhelming. It put Mitchell's soul on life support.
It was easy for me to say, okay, well, I'll just have an extra drink. But then that extra drink turned into 2 extra drinks. I lashed out. I became a recluse. So my family would call. I never wanted to talk to anybody.
Divine intervention changed that.
My brother visited me in a dream, Donovan. It was a dream. And, he said, "What are you doing?"
Mitchell said he later put down the bottle and picked up therapy. It is an outlet he says men in his circle were never taught to explore, citing what mental health experts call toxic masculinity.
It is probably the number one thing that probably prevents a lot of men from seeking help for mental health issues.
The CDC's latest data reveals women are more likely than men to go to therapy. A 2020 survey found more than 12% of women received counseling in the previous 12 months, compared to less than 8% of men. And you would say that gap is due to what?
Seeing it as a sign of weakness and not wanting to ask for help because you might be perceived and people might think sometimes that you're crazy.
Regardless of perception, Mitchell has found a spotter who helps him bear his weight.
I went looking for a therapist and I found a friend.
He encourages other men to do the same, knowing that trying to man up can bring any man down.
Be okay with being emotional. If you need the help, it doesn't make you less of a man.
Well, experts said more men are starting to see a therapist because they now
Okay, so I hope every of us find this information and this video meaningful to you, and like encourage you to encourage the men in your life to seek help if needed. And I would like to ask if Derek or Melanie have anything wanted to add regarding to the toxic masculinity.
Yeah, I mean, I think the same problems that exist in the AAPI community, Melanie's also voiced in that occurs in the African American community and other communities. I think it's important to understand, while today we highlighted the problems that impacted the AAPI community, this is a topic that affects everyone. And while we only talked about men, I also think it's important that we shouldn't undermine the topic of women's mental health as well. While that gap exists in terms of reaching out to therapy, 12% and 8% is pretty low in general anyways. But yes, it'd be nice if, one conversation at a time, we can discourage toxic masculinity and encourage more people to seek therapy and treatment.
Thank you, Derek. And I hope all of us here together tonight, it's like help us to end the toxic masculinity. And here I also share some related resources related to men's mental health. Since the recording will be posted on the NAMI New Jersey webpage later, so I think all of you don't have to like pencil down all the information right now. So before we ended our section, I would also like to invite all of you, including Derek, of course, to visit our webpage, and then you are invited to get involved. You're welcome to become a NAMI New Jersey member, or sign up for a volunteer, or subscribe to our newsletter. Stay connected with us if you want. Okay. So thank you all of you for the questions and comments. And thank you so much, Derek, for giving us such a touching, meaningful, informational presentation. We're so happy to have you here with us tonight. It demonstrates that, thank you. And it demonstrates that, sorry, go ahead.
No, that's it. Just thank you.
Thank you again. And thank you, Melanie. So it demonstrates that we have a shared interest, a passion for mental health. That's why we're here tonight, right? And we aim to breaking the stigma within our communities. Okay. And then I would like to give an extra special thank to NAMI New Jersey's multicultural program leaders for joining us tonight and sharing all the information. We're one of the most diverse states in the country. So in order to meet the needs of our residents, the mental health services and resources we provide must also be diverse. Before we close the webinar, I'd also like to share, just like before I share the webpage, NAMI New Jersey webpage. So if you go to our Get Involved page and click Become a Member, you can know how to become a NAMI New Jersey member. With that being said, all our programs are free, and you'll be able to find where our statewide online support group are, affiliate support groups, multicultural programs, signature programs, as well as webinars and presentation like this one. Please feel free to reach out to NAMI New Jersey, to all the program coordinators for any support you might need. Last but not least, as a reminder, the survey of this webinar will be emailed to you tomorrow, and it would be much appreciated if you can complete it so that we can incorporate your feedback for future webinars. Once again, thank you, Derek. Thank you, Melanie. Thank you for all the registrant participants here. And then I hope you all have a great night. And if you have any additional questions, please feel free to email us or Derek.